All right, let's get back to brass tacks. So we're on the second day of, you know, studying through Anki. We're on the road to MBBS, and without further ado, let's get into it. You know, let's get it started. All right. So starting off with a quote. I would love the light, for it shows me the way. As I will endure the darkness because it shows me the stars. Ooh, nice one. I've noticed even people who claim everything is predestined and that we can do nothing to change it. Look before they cross the road. Good one, good one. All right, so I guess we can just turn this one into a meme review if we don't get any other thing. All right. How do you estimate the volume of normal saline required to correct chloride responsive metabolic alkalosis? I'm not there. So you're going to estimate the chloride deficit. The chloride deficit is calculated by 0.2 times the weight in kilograms multiplied by 100 times the chloride measured. Then you calculate the sodium, the normal saline volume. Then you calculate the normal saline volume by doing the volume of normal saline is equal to the deficit divided by 154. So like this is how I change up this question, right? Tell you what, I'll change it up on my computer because I just like break up each of these. Like I wouldn't put all of this into one card. Like I'll break it up, put the equation for calcium deficit, chloride deficit in one card, and then the equation for volume of normal saline deficit in another card. So honestly, that's how I change up this card. But I've never seen this asked anywhere, so this is interesting. But I'll look at it later. Least disastrous gender reveal in India. What? I don't get it. I really don't get it. And it looks kind of... the fact that it says India and it seems kind of sus. What kind of meme is this, bro? I don't know. It seems kind of sus. Let me just leave it at that. Is portal vein thrombosis a contraindication to liver transplant? Yes. No? I'm not going to make a card on the ETOH plus 20% will start drinking again point here. Really? Recidivism just means tendency of a convicted criminal to reoffend. I don't get what you're saying. I really don't get it. Quote, so is cheerfulness or a good temper. The more it is spent, the more remains. Patients have high mortality and will develop a trauma-induced coagulopathy requiring massive transfusion if they have a positive fast exam and two following. Why would you? So if they have a systolic blood pressure less than 90, or if they have a heart rate less than 100, or if they have penetrating trauma, why don't you? All right, Honestly, it's the first I'm seeing this card as well, so hopefully the next time I see it, I know the answer. Everything in the universe goes by indirection. There are no straight lines. Interesting. What medication helps to reduce iron 3 plus back to iron 2 plus state? Another methylene blue, that's a medication. So come here and change it. What medication Helps to reduce FA2, da 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 da. Well, let's just highlight the whole thing out. Oh man, it's so difficult trying to edit on a phone, honestly. My phone is too small to edit on. I really should do this on my laptop. I don't know why. Anyway, let's go. The look on my face when someone offers to massage my neck and scalp. Okay. Any good crisis can be good. Any kind of crisis can be good. It wakes you up. Okay, interesting. Cardinal movements of labor. Engagement, descent, inflection, internal rotation, extension, external rotation, expulsion. This is a good card. Just that you're putting everything on one thing. What are the cardinal movements of labor? Personally, I find that when I split it up, I'm able to remember each individually more than everything. And I'll be reading it from the top anyways. 5, 6, 7. All right. 1. All right, just skip some of those. No drinks back here unless you have a screw on top. Huh? Unless you have a screw on top? Oh, unless they have a screw on top, as in you can oh my gosh. I'm not even gonna try it. Nah. Intern students prepism. What? I remember this. Back on Reddit when man, it's a Reddit joke. It's a Reddit inside joke. If you're on Reddit, you'd understand the crazy story and the different stories that came from this story. I doubt the original story was even real, but I'm pretty sure that's where this is from. What's up with that crap thing about this? Prepare you to jump over, take it straight. Okay. Alright. Critical. Issues impacting. Alright, you know what? I just got an idea. Instead of going through everything, let me start with a topic first, and then when we finish the topic, then we can do everything. I think that's a better idea. Yeah, let's do that. So let's go to Kawasaki disease, because I've been meaning to do a video on Kawasaki disease. So here we go. What cardiac complication do Kawasaki disease, sarcoidosis, SLE, and poly or dermatomyositis share? Myocardial infarction. Myocarditis. Oh, sorry. Kawasaki disease. Oh, yeah, never mind. What are the inflammatory differential diagnoses of Kawasaki disease? Inflammatory. Arthritis nervosa. SLE? Juvenile idiopathic arthritis. Okay. Okay. What are the hypersensitive drug reaction? I just saw that. What are the most common differential diagnoses to consider in a child presenting with fever and skin symptoms? Fever and skin symptoms. Infective endocarditis. Viral infections such as... I mean... In patients with Kawasaki disease, look for anatomical location, as in the hands, perineal. Why would you look for perineal erythema and discrimination if you think the child has? That's the thing with sketchy cards that I don't understand. They're so out of touch. You get me? It might be a finding you can get in these patients, but why would you look for it? Doesn't make any sense to me, perhaps. What treatment is contraindicated with Kawasaki disease? Contraindicated? Steroids? Corticosteroids. Yeah, they may increase aneurysm formation. Okay. Child with prolonged fever and a rash, which of the following is in the diagnostic criteria? Bilateral pruritive conjunctivitis. I think 5. Yeah. In a patient with Kawasaki disease, what are the risk factors for coronary artery disease? Fever, more than 8 days, something else, and then age less than a year. Coronary artery disease. What else do you have? Fever, age. If they have Asian ethnicity or male sex, okay. I figured it was some other demographic thing. Male sex, okay. Alright. Which type of vasculitis involves aneurysm of the coronary artery? Kawasaki disease. Kawasaki disease is an acute febrile illness of childhood that can have severe complications. Diagnostic classification of Kawasaki disease: they get bilateral, non-exudative conjunctival ejection, basically conjunctivitis. They get characteristic rash, which is a non-polymorphous rash. The anterior cervical lymphadenopathy, they get mucositis with strawberry tongue. They get erythema and edema of the hands, so that's the crash, as you can see there. And the burn, which is fever for 5 or more days. Crash and burn. What syndrome is fulminant? Liver failure and encephalopathy in children with viral illness who take aspirin. Rett syndrome. Thus, they avoid aspirin in children except for Kawasaki disease. What's the most likely diagnosis? 3-year-old boy is brought to the office for fever for the past 6 days. Yeah, I wish this was bigger. Fever for the past 6 days. It subsides. Yesterday, the mother noted a rash on the back of his neck. A rash on his back. The patient attends daycare with several other children who have been sick recently. The patient has a history of sickle cell trait and takes multivitamin. Temperature is 39.2. Pulse is 140. Respirations are 25. Physical examination shows an inconsolable boy who cries throughout the visit. His neck is supple. Both his hands have slightly erythematus and edematous, and he has a macular papular blanching rash on his trunk. It sounds like Kawasaki disease, yeah. I thought there would be more to it, but yeah. Kawasaki disease presents with non-specific signs, including fever, conjunctivitis, erythematus, rash of the palms and soles, and enlarged cervical lymph nodes. Sorry for the noise in the background if you're hearing it. I'm not sure what's wrong with this card. I'm going to have to fix it when I go on my computer. What? Kawasaki disease can result in coronary artery aneurysms that can cause MMI. Yep. What are the usual complete blood count results in patients with Kawasaki disease? Okay, they may have increased white blood cell count, leukocytosis, yeah. What are the acute phase manifestations? Crash and burn. Alright, let me see if I can get all of it from my head. So they get bilateral, non-purulent conjunctivitis. They get a characteristic polymorphous maculopapular branching rash. They get anterior cervical lymphadenopathy of more than 1.5 centimeters. They get strawberry tongue, which is characteristic of the and other features of mucositis, and they get erythema and edema of the hands and feet, as well as a fever that lasts for 5 or more days. All of that I learned from Anki. So it's crazy how you learn so much from Anki, more than how you'd learn from like other resources. Granted, you probably use other resources and put them in Anki, but the fact that I could just remember all of them out of my head like that is because I've done the cards so much. You get me? It's like, and then each different card is just integrated in a way. So like I remember Crash and Burn, but I just read the question, the Euro question, and it had maculopapular rash, so I remember that as well. The edema and the erythema, all of that just comes together. I just love how Anki does that. There's no other app that does that for me, honestly. So that's why I've stopped taking notes, to be trained honest. Elevated CRP and ESR is required to treat a patient with incomplete Kawasaki disease for presumptive Kawasaki disease. The CRP is greater than or equal to 3. ESR should be greater than or equal to 40. For it to be positive, I guess. What is the only therapy shown to reduce the risk of coronary artery aneurysms in patients with coronary artery aneurysms? Is it the aspirin or the IVIG? I think the aspirin prevents MI, so I'm going with the IVIG. Good. Patients with Kawasaki disease may have erythema and edema of the hand and feet. Good. 3 phases of Kawasaki. Acute phase, subacute, chronic, convalescent. Okay. I'm going to change up my card anyways, so that's what I think. I'm going to just change it up, the wording a bit. What are the causes of acute aseptic meningitis? So, viral. But it can also be caused by a partially treated bacterial meningitis, early bacterial meningitis, Kawasaki disease, chemicals. I didn't know Kawasaki disease could cause it, honestly. And this is a screenshot from the lecture. If I didn't put it into a card, I would know. I wouldn't even think twice about this, honestly. Kawasaki disease is also known as mucocutaneous lymph node syndrome. Nice. Anki's the only reason I even know that name. Kid gets Kawasaki disease and gets IVIG. What can you not give for a year? Any of the live vaccines like polio or measles, MMR. Yeah. Treatment for Kawasaki disease is aspirin and intravenous immunoglobulin. Kawasaki disease has unilateral anterior cervical lymphadenopathy. Japanese kid looks like Kawasaki disease. What do you mean by the child looks like Kawasaki disease? It's kind of messed up. They told they have severe pain, abdominal pain, gallbladder high drops, or upper quadrant pain. That's a weird question, to be honest. What is the treatment for Kawasaki disease? What is the treatment for Kawasaki disease? Aspirin and intravenous immunoglobulin. Why did that take me so long to answer that? Alright. You want to look for erythematous maculopapular something rash, morbilliform rash. What do you mean by morbilliform? I've got to look that up. Kawasaki disease patients successfully treated with something should the persistence. IVIG? Okay. Don't know what that question is saying though. What are the subacute phases manifestations? It's kind of a crazy one. So, thrombocytosis and increased ESR. What's another name for Kawasaki disease? I just did this already. It's mucocutaneous lymph node syndrome. It's also called medium vessel vasculitis, but I guess there are other medium vessel vasculitis. So maybe that's not a name for it. It's just maybe the type of disease it is. So yeah, mucocutaneous lymph node syndrome. A rash including the palms. Kawasaki disease. Kawasaki virus. Souza. Bro, this is such a. I'm gonna reword this as well, because he said it's. They said it could also be Kawasaki disease and something else. Why not just add it to the thing then? Why put it to also could be? You get me? Maybe that's just me, but like I'm. Anyway, let's continue. In a patient with Kawasaki disease, something should be ordered as it may reveal protein biomarkers or infection urinalysis. What are the lab results that support the diagnosis of Kawasaki disease? Hypoalbuminemia, steropiuria, leukocytosis, I don't know, elevated inflammatory markers. Okay, that's what I'm talking about. Rare syndrome is fulminant liver failure, aspirin. What are the categorical and differential diagnoses? Infectious, inflammatory, hypersensitive. Echocardiograms should be performed at 2 and 6 weeks. I'm pretty sure URL yeah. Pretty sure URL says 4 to 6 weeks. Some other resources say 2 to 4 weeks. Honestly, I'm gonna go with URL though. Patients with Kawasaki disease may develop a rash in the perineal region, diaper region. Unless, I mean, it's something that you'd note when examining the child. But I don't see how, like, when it says you look for it, I don't see how you'd look particularly for it. You might find it and it ties in with your history and your exam. But I don't see why you'd particularly look for it. It's not like one of the common. I don't think it's one of the most common features. Alright, we're almost finished with Kawasaki disease. Other than plaque rupture and full coronary artery aneurysm, what are 3 less common causes of myocardial infarction? Kawasaki disease is 1. Coronary artery vasospasm, vasculitis. I can fix for this question. Non-purulent polymorphous rash. Polymorphous to discriminating. Okay, it can discriminate. Okay. I think I saw a question with discriminating. I'm like, what is the people talking about? Conjunctivitis. Okay, which one is missing? The fever, the rash, conjunctivitis, cervical, changes in extremity, mucositis. Mucositis is not there. Yeah, changes in the lips and oral cavity. A 4-year-old Asian boy has a rash on his palms and soles and tachycardia. What condition should be suspected? A 4-year-old Asian boy has a rash on his palms and Kawasaki disease. Why don't my brain just froze up? What? In a patient with Kawasaki disease, echocardiography should be performed at diagnosis 2 weeks, 1 to 2 weeks, and 4 to 6 weeks follow-up. Clinical features of Kawasaki disease. That's just a review question. Child with Kawasaki disease is described. What's the most important investigation? Echocardiogram. This was. I don't think it was just a Euro question. I think this was an actual. It was an actual past paper question. What is the treatment for Kawasaki disease? Intravenous immunoglobulin and aspirin. Manifestations of scarlet fever include fever, sore throat, some people rash. I'm gonna fix up the question. What lymph node cluster drains the head and neck, cervical? Patients with Kawasaki disease may develop swelling to the hands and feet, which lymph nodes are enlarged in association with upper respiratory tract infections, such as infectious mononucleosis, Kawasaki disease, cervical lymph nodes, deep cervical lymph nodes. So it's the deep anterior cervical lymph nodes for Kawasaki, apparently. What is the cause of prolonged high fever and In cause of the persistent release of inflammatory cytokines. Hold on, I need to drink some water, bro. Funny enough, and I wish I was making this up, it's actually 69 days before my final exam, the exam I'm preparing for. 69 days. Wow. Do you look at that? All right. The vasculitis. These are the different formations. Rash. Honestly, it gets repetitive, honestly, because I know the answers for these already, so sometimes I can just skip through them. So if you see me like skipping through them, it's because I just know the answers already. And yeah, it's just pointless. Male sex. It's just pointless, yeah. What lab result? Oh, this is one I got wrong the other time. Oh, it was increased inflammatory markers. Elevated inflammatory markers, yeah. Yeah, this is 5. So like some of these, if you see me skipping through a lot of them, it's because I just know the answers already. And the time it's going to take me to say it, I just know the answer already. It's just how it is. But if you don't know the answers for these, just pause the video. Whenever you see a card come up, just pause the video instantly, because sometimes I might skip through it and never really realize I'm skipping through it quickly. All right, so we're done that, so let's go back to just to check out some memes. So a 10-year-old movie, 10-year-old YouTube video. Yo, you look sad today. Actually, I'm sad every day. I just don't have the energy to hide it today. Dang. I felt like this was actually in the movie. That's crazy. I feel like I watched all the Ice Age movies and I'm pretty sure this was in it. I'm pretty sure this line was in it. That's crazy. Yo, today while I was walking outside, I found a K-pop one. Oh, I have a friend I need to send this to, but I'll send it afterwards and I'll post the video. That's crazy. Persistent maternal shock for pregnancy near term during trauma is an indication for what? Persistent maternal shock. Delivery? I don't know. C-section during expiratory laparotomy. Okay. I mean, if you become a surgeon, you're legally allowed to stab people. Man. Yo. Yo. Let me just, dumping syndrome. What's the medical treatment for dumping syndrome? IV fluids, small, low-fat carb meals, high in protein. And avoid liquids with meals, so as it slows gastric emptying. I want to fix up this question. This isn't the train to Hogwarts, son. What? Yo! What? What kind of... Oh my gosh, let me skip that quickly. Let me not even dwell there too much. Oh... Students be like the attending isn't even giving me hints about what electrolytes. Students be like, hold on, let me read it. I just got it, but let me read. Students be like, the attending isn't giving me hints about what electrolyte needs to be replenished. The attending literally puts a banana in his head to the point where it looks like Zeke. Yo, if you don't know Zeke, he's from Attack on Titan. You should watch it. It's my second favorite anime. Honestly, I just finished watching it a couple days ago, and it's been out for like a couple weeks, months actually. The final episode. It's a really good anime. You should watch it if you get the chance. You're an astronomer. Hey there. What? POV, you're an astronomer. Hey there, sexy. Is that a telescope, or do you just happen to see me? It's a test. Be positive and trust the timing of everything. Just because it's not happening right now doesn't mean it will never happen. Stay patient. That's good advice. Good advice. When someone is telling you a joke, but your ears are too small to hear. Me, an introvert, remembering a funny joke I said 2 years ago that made everyone laugh. Aw, that's me. That's on me. I don't remember 2 years ago, but yeah. M1 prepping for their first exam. M4 asking to leave the hospital at 11 a.m. Yeah, I mean, in final year, you're just over it, man. You just want to leave. You honestly just want to leave. Quotes. You are the light of the world. A city that is set on a hill cannot be hidden. Amen. I will instruct thee and teach thee in the way which thou shalt go. I will guide thee with mine eye. When are the... Wait, what? Are these two different stuff? I feel like these are two separate stuff. Yeah, these are two separate stuff. I don't know why. When they start massaging your head and sleep, the sleep switch will flip. Why did I post this under it though? It's so random. It's the muscles of the head and the scalp and the neck. Quote, by nature, man hates change. Seldom will quit his old home till it has actually fallen around his ears. Wow. Yeah. But then again, there's a really good quote that I love, bro. Let me actually type it up before I forget it. I don't remember who said it originally, but it goes like this. Nothing changes if nothing changes. So like if you want to change something, if you want a different result, you need to do something different. I believe this is like the new age or Gen Z version of the quote that says, a fool does the same thing expecting a different result or something like that. Or it's foolishness to do the same thing expecting a different result. Nothing changes if nothing changes. Simple. That's how simple way of saying it. Let me just save it. Right. It's easier to fool people than to convince them they have been fooled. Whoa. That's a good one. That's a really good one. That's a really good one. By nature, man hates change. Yeah, that's that one. Pretenders are worse than murderers. Beware of false friends. I feel that's in the Bible somewhere. Always remember that you're absolutely unique, just like everyone else. I mean, you're the same in the fact that you have a unique trait that nobody else has. So everybody has a unique trait that nobody else has, and that's what made them unique. But they're the same in the fact that they have a unique trait, but the trait itself is not the same. Why am I trying to explain it? The voice of the Lord. Sorry. The voice of him that cries in the wilderness, prepare ye the way of the Lord, make straight in the desert a highway for our God. When you and your homie say you can't game tonight because you're busy, then get matched against each other. Yo, if this ever happens in PUBG, I'd be so amazed. That'd be so funny. When you get in a tight place and everything goes, if you play PUBG, drop your tag and I'll add you. I don't think I'll start a gaming channel because those are kind of more competitive videos to start, but I might do it. I might do it just because I want my time gaming to be productive. So at least I'm getting something back from it. Because if you just play games for hours on end, there's no real world of reward from it. But if you upload it to YouTube, there's a chance that you get some amount of engagement, some amount of following, especially if you go through, you edit the video, you upload a shorter version of the video, you upload shorts, let me not reveal all of that. I might start a gaming channel if I don't already have one. If you find it, let me know, but I don't anybody knows I have it, honestly. But yeah. Pharmacy out of sildenafil. Medical medicines. I think this has the same thing to do with the priapism joke. That was on Reddit, honestly. It was on it for a while. It's probably still on it right now. I cannot say whether things will get better if we change. What I can say is that they must change if they are to get better. Ooh, that's odd. Medical advantages of the circle system include. What do you mean by what is the circle system? Major disadvantages. I have no idea what that's talking about, so I should have read Butch textbook. What's used to treat aspergillosis? It's a type of medication. I really don't know. Warinacozole. What drug is used to treat aspergillosis? The fact that I have to ask the question in my head and the question just being there is what throws me off sometimes. So I just like to have the question there. Most gastrinomas are found in the gastrinoma triangle, which is composed of the head of the pancreas, the neck of the pancreas, the common bile duct, and the third portion of the duodenum. Okay. Condoms aren't biodegradable. If you care about the planet, have unprotected sex. What? Wait. What? Okay. One condom is much less waste than the amount of waste that baby produces. I get you. Wait, but you're justifying. Oh, you're justifying a condom. Okay. Okay, I get it. A baby is biodegradable. Wait, huh? No. What? Oh, this is the people who are pro-abortion. Pro-abortion people think, oh my gosh. Let me not even get into that political debate. If fear is cultivated, it will become stronger. If faith is cultivated, it will achieve mastery. Okay? Being fully naked feels less naked than being naked with shoes on. Because being naked with shoes on just feels weird because you're not fully naked. But I don't know, it's just imagine if you have your socks and shoes on, but everything else is. I feel like Let's medical student. I don't need a break. Anesthesia. You have disrespected me, my teachings, and my entire culture. What sign is ecchymosis in the flank area? Oh my gosh. Ecchymosis in the flank area. Oh, jeez. Great Turner sign? It's not. It's probably the other one. It's Great Turner sign. Nice. What's the other one though? There's Great Turner sign. There's Cullen's sign. Okay, Cullen's sign. That's the one I couldn't remember. But yeah, Great Turner has. Ooh, it's been a while since I've learned that. Wow. Anki really knows to pull back up questions that you haven't done in a while. It's crazy. Which men's syndromes present with increased catecholamines and increased type 2A and 2B. Okay. I mean, I got it correct, so I'm not even gonna change it. People trying to insult me who insults myself on a daily basis. When you're about to go to sleep and your brain does that word falling thing. Oh, there's a term for this. I don't remember the term, but there's a term for that. I felt that sometimes, like you're falling in your sleep. It's been a long time since I felt it, but it's a weird feeling. What are the molecular findings? Oh. What is ALCL? What is ALCL? Memes. I honestly don't know what to think of this picture. Is that a rat? What? A man named his triplet daughters Maria, Rose, and Sina, based on the three all on Attack on Titans. The nurses and doctors that watch Attack on Titan. Oh my gosh, you know where this is going. If you don't know, all right, for you guys that don't know, I don't want to spoil the show. So if you don't want to be spoiled by the show, just skip ahead, like 10 seconds. But basically, I don't want to spoil it, but basically they get eaten. It's like, wait, no, it's even worse. Because I'm pretty sure how it went that their mother gave birth to them, and oh yeah, the king, which is the father, forced the 3 children, to eat the remains of the mother, so that the power that she had, I'm not going to spoil too much, but the power that she had be transferred to them, and then the bloodline would continue. As to what happens after that, it's crazy. Let me not even think about it anymore. My reaction is the same as the my reaction is the same as the as Levi and others that were done about it. That's nobody dressed better than a lady who knows that her ex is going to be there. Wow. What 2 tests can be used to determine the patterns of clot and formation and thrombosis guiding administration? CBC, a TEG, and a ROTEM. I've never ever heard of these terms ever before. I'll let you know that right now. Never in my entire life have I heard these terms. The caveat point of care ultrasound exam looks at what structures when triaging patients for surgery. I don't know, and you're asking all 4 at the same time. Cave. Oh, the cave. I see what you're trying to do there. Cave AT. Is it anesthetic triage? All right, so chest, abdomen, vena cava, and extremities. All right, quotes. A man shall eat good by the fruit of his mouth, but the soul of the transgressors shall eat violence. He that keepeth his mouth keepeth his life, but he that openeth wide his lips shall have destruction. Nice. Still confused as to why I need to put my cake in the oven at 120 degrees. Yo, I want to send this to my dad. Oh man, I wish he wasn't here. Yo, after I post the video, I'll send it. Oh, gee. My dad's a cook, so he's going to love this meme. Oh, my God. My reputation grows with every failure. Interesting. Hey, it's Mr. T. Who's the chick? Mr. T. It's April Fools. Huh? Oh, it's April. Fools. The come up. It's April. Bro. I'll look at this a bit later. Wise men speak because they have something to say, while fools speak because they have to say something. Interesting. Sometimes God uses small things to help us have big faith. A 68-year-old man has been suffering from cough, productive green sputum, and shortness of breath. Is there pneumonia? Let's shoot the last line. What's the most likely cause of the hyponatremia? Okay, fluid overload. Okay, he has a cough productive of green sputum, shortness of breath. When he was at A&E, he was drowsy I'm confused. He is found to have a sodium of 115, a normal renal function with plasma osmolality of 260. What is the most likely cause of the hyponatremia? Could be SIADH for real. There are only two ways to live your life. One is as though nothing is a miracle. The other is as though everything is a miracle. Every great dream begins with a dreamer. Always remember, you have within you the strength, the patience, and the passion to reach for the stars to change the world. Nature takes away any faculty that is not used. Never apologize to others for their misunderstanding of who you are. Philippians 2 verse 3 says, don't do anything from selfish ambition or from a cheap desire to boast, but be humble towards one another, always considering others before better than yourselves. Yo, what? Seeing as America has a lot of school shootings, and seeing as guns aren't the issue, maybe schools are the issue? Why have no one thought of this? If we ban schools, school shootings will stop. Yo, I don't want to leave it there. Let's leave it somewhere else. How many organisms does the most infectious droplets of TB contain? 5. How do I remember that? How did I remember that? Normal MCV range is 80 to 100. Some sources say 75 to 80 to 95 or something like that. 80 to 100. All right, let's leave it on this quote. A righteous man hateth lying, but a wicked man is loathsome and cometh to shame. And with that, we are going to end off this video. Thank you for watching. Hope you learned something. Hope it was helpful. If you have a topic that you'd like me to do in the future, be sure to comment it down below, and we'll particularly focus on that, all right? But until then, we're going to do the most high yield topics that has to come up on exams. All right, see you in the next video. Peace.